I wanted to be the provider to provide the care that I desperately needed.
Brandon Benton is a recipient of the Callen-Lorde's Keith Haring Fellowship, a program based in New York City that educates nurse practitioners in LGBTQ healthcare. Its goal? To make comprehensive LGBTQ care a standard everywhere.
I'm such a firm believer that LGBTQ healthcare should be in primary care. 15, 20 years ago, nobody was asking me the questions that I didn't have words for at the time to name what I was going through or what I was feeling.
The Callen-Lorde Health Facility is the oldest LGBTQ care clinic in the country, providing health care for more than 50 years, regardless of ability to pay. Now, it's taking the lead in educating the next generation of LGBTQ healthcare providers.
The real mission became training providers that would leave the program and create that outward ripple effect, and therefore create access to LGBTQ+ care and primary care wherever they went in the country or the world.
This fall, Brandon and his wife Maggie relocated from West Virginia, virtually an LGBTQ healthcare desert. It's one of 22 states that have banned gender-affirming care for minors. In the program, he and 2 other nurse practitioners will go through several clinical rotations, including HIV treatment and gender-affirming care for transgender patients.
I want to be a leader in LGBTQ healthcare. I want to make a difference, and I want to be a voice for the community because so many of us aren't able to have a voice.
What makes this program unique is its ambition and its reach.
In our research, we haven't found any programs for nurse practitioners that train for all populations of LGBTQ+ communities and HIV. So we are the only program that we have found that really comprehensively cares for all the communities that embrace this wonderful population of care.
The 4th cohort of fellows follows in the footsteps of alumni who have successfully transitioned from the program to become medical leaders and educators across the country. Some have even established their own LGBTQ healthcare practices in Maine and Seattle, while others contribute as health clinic educators and specialists in the South Atlanta and the Bay Area.
So I'm actually the only provider in this building that provides prevention and treatment for HIV.
Brittany Smith was a fellow in 2020. Now she works as an HIV expert at Grady Memorial Hospital in Atlanta, the 10th largest public hospital in the U.S. Brittany and Brandon recognize the opportunity the fellowship provides, not only to offer care, but to be pioneers for a healthier future for their community.
The patients, a lot of them get excited when they see me because they feel like they can relate to me. You know, like I said, I'm a Black woman, I'm a queer Black woman, a masculine presenting queer Black woman. So I feel like somewhere in there, a lot of our patients can find something that they can relate to.
This is such a great opportunity, a career launcher, and really taking what I learn here and taking it out into the world. And no matter where I end up, I know that I'll make a difference because I can.